Thank you, Don, for spending your time with us this week and for sharing your knowledge and expertise with the vanguards. I'd like to start the conversation by just capturing your reflections on what you've seen this week out with the vanguards, what's really struck you, and also perhaps reflecting back on some of the other vanguards that you've seen in your other visits.
Well, this week, like every week I've been there, has been really exciting for me. It boosts my spirits. I just need to acknowledge my debt of gratitude to NHS England and to the King's Fund, both of which make it possible for me to come here for a week every few months. And most of the time I spend traveling around the country, visiting new care model sites, vanguard sites, and others, finding out what they're doing, forming my impressions, and feeding them back into the system. It's great. It's amazing what's happening here. I'm a pediatrician and a father, and if you're watching your children all the time, you don't actually notice the changes. It's when you come and go and you come back and say, oh my goodness, look what they can do now. I actually feel that way about these vanguard sites. They began with a very ambitious agenda, and one that no one had really done before, to try to transform care to be more patient-centered, community-based, integrated, to save money wherever they can, and to improve quality right across the board. And they're doing it. Each of them would describe the rocky road, how tough it is, but what I see is tremendous progress. This week was a week that I spent largely in the Midlands, visiting, for example, the Aerowash Vanguard in Derby. It's very impressive. The general practitioners have come together there in a highly collaborative way. They've created a whole new pathways of entry to primary care, offloading some of the GP workload, which is really important because the GPs are feeling so stressed, empowering advanced practice nurses, setting up an on-day, a same-day unit that is amazing to watch. They've got 10 different changes underway there. 5 of them or so are in the community. It's clinician-led, thoroughly supported by the CCG and it's teamwork. Same at Principia, where again GPs and other clinicians are working together in a way I don't think they've ever worked together before, with real results in reducing A&E utilization, smoothing flow, reducing admissions from care homes. The Mid-Knots area in Nottingham, again, extraordinary work on. In that case, they're working hard on that flows into the A&E so that people really get to the kind of care they need very promptly, and not necessarily using resources they don't need. I mean, I could go on, but these are maturing examples of high levels of cooperation. And the other thing is they're having fun. I know the stresses in the NHS. I've seen them, and I feel my heart is with the people who are feeling so stressed, and sometimes maybe actually even without a lot of hope that things are going to get better. Not in these places. They're sensing autonomy, a sense that they can do things, which is wonderful. And let me just say, I'm talking about the vanguards because you asked me to, but that's not the only good news here. I mean, there are many places that are not badged as vanguards that are starting to really get energized. So it's wonderful to get to be here.
So what is it that you think are the kind of key ingredients that make not only a successful vanguard, because actually, as you said, there's many, many different areas across the country that are doing really, really good work, but what are the key ingredients to really make a success?
Well, starting with the vanguards first, I don't deny that some of the special resources that they were given have been given, the permission that they've been given, the kind of sense that they're going to be pioneers, that's helped. In a number of cases, I remember Duncan Gooch, the leading clinician in Aerowash Vanguard, said, we were sort of on this road anyway, but when we got badged as a vanguard and got some resources, we could really accelerate. He said what would have taken 10 years has taken 2. So I credit that. But I think there's a more subtle story here. It has to do with things that could appear and do appear even in non-vanguards, and that is, well, let's start with leadership. These are executives, CCG chairs, chiefs of departments, even politicians, who are sending a message. They're saying, I trust you. I trust you. I think our workforce is able to do this. And I trust our communities. They can help us do this. And releasing this energy that's really there. They give permission to fail, which is crucial. Look, the NHS has got to learn its way to a new ways to deliver care. Better for the workforce, better for the patients, better for communities, better for the exchequer. And that's not automatic. You can't do it like install it. You have to learn it. And so, watch a kid learn to ride a bicycle. They will fall. They have to. That's part of bicycle learning. So the ability to try stuff out and have it not work the first time or the second or the third and keep going and try again, that's a leadership issue. You have to create that context. In the successful places, they've actually released the workforce and the feeling of being watched all the time or at risk all the time. Some resources help, whether it comes from the vanguard allocation or other ways, clever ways to get people a little extra time. I think they meet, I don't know another way to say it, but people who need to work together, who are in the same system but may not know it, and who've never really gotten together and said, what do you do, what do I do, how can we do this better? That time is essential. Yeah, it's an investment, and I think it's a tough thing. You have to reserve the time to meet and learn and grow.
What would you say to people who are struggling to find that time, or maybe struggling to feel that they've been given that permission? What would you say to them? So if somebody's watching this now thinking, well, how do I get there?
It depends on whether I'm talking to a leader or to a person who doesn't feel that they're a leader. To the leader, I say, invest. It's not a lot of money. We're not talking about vast sums, but just enough slack, just enough, people call it headspace here, so that there's time to take a look and try. It's an investment worthwhile, and I guess I'd say any way you can come up with that little extra dose of freedom to learn is going to be worth it. Indeed, you might lose some productivity in the short run, but you play short run all the time, you just stay stuck. And the permission to fail, that in a way that's easier. I think it is. Decide as a leader, do you understand that the best route to success is not control, it's release. Yeah. And what you're releasing is the energy to learn. And if you're going to have learning in your organization, you're going to try stuff and it won't work sometimes, and that you got to celebrate that. If you're not in that control, in the leader position, what can I say? You only live once, and you can decide. Are you going to spend your career in a mode of victimhood or not trying, or are you going to say, I'm going to find a way to try? And I know that sounds naive, but think hard, because this is your life. And I think that people care about their work. They want to try things. In the happy conditions, the leader discovers that energy in the workforce, and the workforce discovers the spirit in themselves. Can I say one other thing about this? Yeah. Another lesson, especially vivid this week, has been what I call emerging leaders. So this week, as I say, Duncan Gooch, a GP in Arawash. It's Tim Taylor, a radiologist in the MRAT group. It's people I've met in Morecambe Bay. Andy Knox, leading real community change. These people aren't badged leaders. It's not like they have a title. They just want to make changes, and they emerge. It's thrilling to watch it. And as a resource for the NHS, this is extraordinary wealth, and I they're all over the place. They're all over the place.
So, can you see that there'll be any potential problems that people might be facing in the future? I mean, is there anything that strikes you that they need to be aware of?
Sure. You're a nation in transition with respect to your health service. Transitions are difficult. I guess part of it is the grind of daily work. People are really feeling stressed in the NHS. They are in other systems around the world, but here, they're working really hard. They're working to their limit. And when anyone shows up and says, now change, or please get involved, or help change, or lead change, where? How do I do it? I'm too busy, and I understand. And I think it's a barrier. Nothing beats friends. So, believe me, other people feel the same, and I think you can get together, decide what you wish to do together, find the energy to be together. That's overcome that barrier. The risk of surveillance, that, for understandable reasons, the country is invested in scrutiny and accountability and hitting targets. That can help, but it can also hurt. And I think that at some point, what can I say? Give up the target mentality. Even if you're still being watched, even if the targets are still there, and they probably will be, don't let that control things quite so much. That's a barrier to overcome. I guess, tick the box, you need to, but that's not the job. The job is creating the future. And I'm not saying that's easy, but I know it can be done. I've seen it every visit.
So it's possible?
Oh, yes.
So I was struck when we started as a vanguard by hearing you and Simon Stevens giving that permission, talking about recognising how hard this was going to be, but actually that if it's not hard, then you're not pushing enough. So we're coming to the 3rd year now of the Vanguard programme. What is it that people can take with them beyond the Vanguard programme? So the Vanguard has given freedom, it's given space, it's given the permission, and it's been inspiring as a programme to work through, because it has, in a way that other change programmes have never achieved, it has given people that inspiration. So we're in the 3rd year now, and it's really about, okay, so what's next? So you inspire the vanguards when we started this programme to give them that permission. What is it that's next? What can they take with them to continue as the programme moves to its next stage?
I want to be careful, since some of the people listening to this conversation are not vanguards, and I think there's vanguard envy. People talk about. No, I mean, you are a vanguard. If you feel like you're one, even if you weren't badged,
even if you're not
get
given
the money.
The title.
If you just mean small V, you can be a leader. So let's keep that in mind. Lessons. Well, first, a few ideas. One is there are vanguard efforts all over the country. I think now is a good time to begin to become immensely curious about that. I get to visit. I get to go to Erewash or Morecambe Bay. You may not, but you can. And I would say, if you're a leader, get on the train, get on the phone, find out. And I think the NHS England can help with that, and you can help connect up. And this isn't a matter of send me a brochure that tells the story. You've really got to go see it. And I'm a fan of visiting. You're not, you're a wonderful country, but not that big. And you really, for an hour, for a half day, you can go see some of the great stuff. And, it won't exactly fit where you work, but you can adapt it. You're smart. You'll see something that someone else has done, and by the way, you might teach them something you've done. So you've got a reservoir of lessons. Let's learn them. I think another is a psychology, and I want to be respectful because there are others that have to make this choice. But I don't think the vanguard effort should end psychologically. Maybe the funding isn't there anymore, or the badge, the formal badge isn't there. I don't know. In fact, but the effort won't. So this is just like it's phase 1. Now comes phase 2, which is maturation, expansion, sustainability, stabilization, spread. These are all the challenges now, but your work is nowhere near done if you're a vanguard.
Is it maybe around almost, you talked about the badge, is it around maybe dropping the badge now and saying, okay, so some areas have had that accelerated support, so now actually this is about the spread, and how do you actually enable that spirit to enable other areas?
I mean, you can have a Vanguard alumni club. I might do that, make a new badge, but I don't. It's not over.
No,
it's
the beginning,
moved.
Maybe.
Okay, so spread. First of all, you can't spread something if it isn't something. So the work needs to continue. In every single one of these places, as much as they may celebrate the early successes they have a lot more work to do.
Yeah.
I mean, the numbers are starting to tip, but they're not in hand.
Yeah.
Not the way they need to be. I think the next phase should include what I might call ambassadorial thinking.
Okay.
I don't want to embarrass him, but I'll take this guy, Duncan Gooch
Yeah.
at Airwash, as an example. He's very nice, quite smart, to say the least. Energetic. The room sizzles when he's in it with his buoyancy. He can become a kind of resource and go around spreading the news.
Yeah.
Not that anyone would ever copy them. They can't copy, but you can learn from. And you've got hundreds of these people, hundreds. And I think that idea of people meeting people would be really, really good. Mm. I think that the 5-year forward view contains some specific goals. In fact, the next steps review. I mean, it has mental health, A&E, and cancer improvements. Great. So now, we have some national ideas about some hills to take. Could we take this energy wherever you are and concentrate it on those? Continuing the learning. But one other thing that impresses me, and this is true across the board, including in many non-vanguards I visited, it has to do with the new relationship with the patient and the community and the carer. For example, I got to visit the cancer center at Guy's Hospital. Oh my goodness. I mean, it's a beautiful building, but the building's only a small part of that story. What's going on there is a very sincere, deep set of ideas about relationship with the community served, in which they become partners. They're co-producing. And that's not just a word. This is true relationship development. When that kind of culture change happens, it's massive. I mean, you're looking here at a whole new way to think. And I see it everywhere. Everywhere that I travel around the country, this new relationship. Again, in Airwash, we met Jessie, 90 years old, in a program called Time Swap, which is not just there. Apparently, it's national. But so Jessie's a woman who has raised her family, has skills. Knitting is one of her skills, but had become isolated in the community, and was sad. And this program comes and gives her a chance. She swaps time. She knits for others, and others do stuff for her. Yeah. It's the NHS site that arranged this for the community. Jessie's life is transformed for the rest of her life. The wonderful thing she said, I love to knit, but I had no one to knit for. Now I do. Oh my goodness.
The sense of purpose is back.
Yeah. That's a cultural transformation for the NHS. Yeah. It says we are a resource to our community, and if we can think broad, that can change and percolate. What Andy Knox has done up in Morecambe Bay, a GP, taking 2 days a week out of his practice and bringing the Daily Mile, the Run a Mile program, to 2,000 kids in primary school in Morecambe Bay, running a mile a day. That he may eliminate obesity in Morecambe Bay. And by the way, he's just gotten permission from the NHS to generalize to all of Lancashire. Soon it'll be 5,000 kids running a mile a day. Transformative thinking like that isn't about vanguards. That's a change of mentality.
So it sounds like there's some real key ingredients around space, around trust, around permission, around leadership. So, really quite simple ideas really about really making change happen. Is that what really resonates with you?
Yeah, it's a great list, Stephanie. I'd add teamwork. It's trust in each other and empowering everyone. This isn't just about doctors, for sure. There's other professions, nursing, pharmacy. We can only get this done together, not separately. There's the whole idea of learning. There's one piece of this that I think I will advise, which is there are ways to learn, like quality improvement methods, plan, do, study, act cycles. It sounds like jargon. No, this is equipping a workforce to change its work. Once the trust is there, once the permission is there, now they have a method to actually try stuff out. And you see that at work. There's this marvelous program, which I hope your viewers will, if they don't know about it, they should. It's the Q program that the Health Foundation has been supported to set up all over England. There's and Wales also, I think. And some in Scotland. There are 5 in Northern Ireland to be complete. There are I think now it's 1,500 trained staff, middle managers, clinicians, nurses, trained staff who know how to improve stuff because they've been trained.
Yeah.
Use them. They're there, and they're only one cadre. So I'd say I'd add that to your list of good news.
Okay, so is there anything finally that you would want to kind of share with everybody? Like you say, it's not just about the vanguards. There is some fantastic work going on up and down at the country, just to inspire people to do that little bit more, to find that extra bit of energy, to really drive them to make change happen.
It's hard to put it all in one sentence. I mean, I guess some of it's about aim. How good could we get?
Yeah.
And the answer in England is phenomenally good. I mean, the potential here for healthy communities, for a joyful workforce, I mean, the phrase we use in the Institute for Healthcare Improvement is "what matters to you."
Yeah.
Medicine for actually doing for people what matters. It's enormous potential. And down the street, there's a place that's starting to do that. You can too. Method matters, and so please take seriously the idea of improvement skills becoming embedded thoroughly in the NHS. Learn it. If you don't know it, learn it. And then get together. I mean, you can't do this alone. You can't do this alone, no matter how good a doctor you are, or how dedicated a nurse, or how smart a manager, or how powerful an executive. You cannot do this alone. And so, vanguard or not vanguard, this is the time to get together. That will happen most powerfully at the level of communities. And if this country acts as smart as it is, it will use the affiliation, the love, the sense of togetherness of a community as the basis for recreating health and well-being.
Thank you. Can I thank you for your time this week and the other time that you spent with the Vanguards? I know you're coming back again to visit people later on in the year in November. What we're hoping to do is actually bring some of that in a celebration, really, of the programme. So thank you for your time.
Well, thanks goes the other way. This is an enormous privilege, and I really appreciate it.
Thank you.